Hi, Prof. How you doing?
Hi, Joel. Should we don't let people in yet. Maybe,
No, no.
maybe we'll
Just to
wait.
know, the meeting has been set up so that it records automatically, so it's sort of straight. It's recording from
That's
now.
okay. Can I just check in terms of the slides, Joel? Are you projecting the slides?
Yes, I will
I need to
share
just
them.
double check that So which ones do you want me to do?
So, 3 and 4. So 3 is the one that just briefly that bit of this was from some stuff Chris had done some while ago, apparently. Wave 1 data,
I
looking at.
can't see it very clearly, but
Hang on, let me make it a
when you
bit
put it in
bigger.
projector mode.
Oh yeah. That just sort of indicates the variation by occupation and ethnicity, migration status. This is the scores for the physical activity index.
And then, so you want me to talk to that?
And then this is just briefly the bit of kind of background about.
You want me to do this bit, right?
Yes, please. I
Yeah.
think so. And then I'll take back. So I'll set up, hand to you for those 2 slides, and then I'll take back over for the rest, basically.
Okay. That sounds good.
Does that sound okay?
Yeah. Should we just wait a few minutes? Wait till 1, I think, probably, Joel.
Yeah. Great. Great. Yeah. Numbers of people registering kind of carried on going up right until today, really, actually. So I don't know quite how many people will end up being here, but I think a good number. Perhaps I'm trying to I'll start showing the screen now so that people so that you can see it when they arrive. Notice that this version of PowerPoint doesn't have a sort of present in Teams option, actually, so I'm having to when I'm sharing my screen, actually, I now can't see Teams, which is a bit not ideal, but I'll keep an eye on that.
That's okay. And will you do the sort of hands up type? Well, you'll share it, so it's fine.
Look at people in.
It's 1 o'clock, so maybe we should let people in.
Yeah, admit them. Okay. Hi, welcome everybody. Thanks for joining us today. Just seeing the numbers sort of ticking up as people continue to join. So let's just give a moment or so before we kick off, so that we've got everybody through the door. Okay. No, still got people around. We'll give it another minute or so, and then we'll make a start. In the meantime, I hope everyone's okay. Thanks very much for joining us, being part of this launch meeting for the new network. It looks like the number of the people arriving is slowing down a little bit. And we're just ticking past 1 o'clock. So probably what I'll suggest we do is we'll make a start. You might have noticed, actually, it's worth just saying at the outset that the meeting is being recorded. Hopefully that seems okay. There are a number of people who have registered and wanted to be involved but couldn't make this specific time. So we've agreed we'll record the meeting and make that recording available to everybody after today. So just to be aware of that, we are recording from now. All right. Well, let's think about making a start then, shall we? We've just got an hour today, so it'd be worth us making a proactive start now. So thanks very much for joining for this launch event for NHS Chorus. My name's Joel. I'm going to lead the meeting today. I'm the research associate working on this project under Professors Parikh and Wolf, both of whom are here today and will say hello and say a few words at a point over the duration of the meeting. Clearly, we're quite a big group, aren't we? We are sort of 55 of us in the meeting at the moment, and actually still a few people kind of creeping in minute by minute. So I suggest we won't do a kind of a round of introductions or anything like that, because clearly it's just a risk that we sort of use up the whole hour doing that. But if you wanted to sort of pop into the chat your name and the role you're in, or where you're from, it might be interesting to other people in the group to get a sense of who's here, who's represented, what kind of job roles of people are in this network, then please by all means do. But yeah, I'm going to suggest we don't do formal introductions and we think instead about making a start now. Great. All right, so I'm going to share my screen. Oh no, actually you've already got it, haven't you? But I'm going to put my screen like this so that you can see that. I'm in an environment today where I've actually only got one screen. So now that I've shared this, I can no longer see you. So if you're trying to get my attention or anything and I'm not responding, please do by all means pop your mic on, give me a shout if I've missed a message. So welcome, thanks for joining today for this launch meeting for NHS Chorus, this new network of trusts interested in physical activity in healthcare workers and how physical activity can be used to support the health and well-being of the workforce. Great to see so many people here, delighted to have such good level of attendance, and we're looking forward to collaborating with you through this network. So I've put a couple of points here for an agenda for the meeting today. We've got an hour, and so what we'll do is we're going to start just briefly thinking a bit about the kind of background, the overview, project kind of overview, just to give you a sort of a brief bit of context, I suppose, for understanding where this work has come from, why we think this is a useful area to be focusing on.
Sorry to interrupt. I think your slides for me haven't changed. I don't know if you're still in project. You're not in projector mode for me, I don't think.
Oh, thanks for letting me know that. That's
okay.
odd.
I can see that now. Yeah.
Has that worked? Has it?
That's
Yeah.
better,
Okay. Great. Is that gone on to the next slide now?
It has. Yes. Thanks.
Brilliant. Super. Thanks for letting me know that. Okay. Great. Yeah. So we'll spend a few minutes just briefly. Prof. Parikh will talk to you briefly about the background and this kind of context for the program. Then I will say a bit more about this network, about NHS Chorus, and where I'm hoping we can then sort of spend the bulk part of the session today on this third point down, focus on a current practice in the area. One of the things we'll say a bit more over the duration of this hour that we're trying to do through this network is really sort of map out a sense of the landscape at the moment in terms of what's already going on around the country. What are trusts already doing to support or improve physical activity in the workforce? And I'm going to suggest we spend a bit of time today actually starting to think a bit about that, discussing a bit about that, and gathering some of that information over the duration of this meeting. Then a little bit of time saved towards the end, plans for meeting 2 and 3. Hopefully you'll have seen on the initial information inviting you to be part of this network that we've proposed initially to have 3 meetings over the duration of the sort of about the next 9 months or so, today being the first of those. And so we thought it'd be useful just to hold a bit of space today for to get a sense from people about what you might want to see in those second and third meetings. We've got a bit of a sense of some of what we think would be useful to cover, but it'd be interesting to hear from you as well if there are specific things you would hope to see or have covered in those meetings. Final point now, I've got some questions and discussion or any other business, but actually in reality, if you've got questions, don't actually feel the need to hold on to them right to the end. Pop your hand up, stick something in the chat. Clearly there's a big group of us today and we've got a limited time, so if we're able to answer the question there and then, we certainly will. If it's something that really needs some further discussion, it might be that we pick that up with you individually afterwards. But if you have a question, please do by all means just pop that in as we go. All right, well, hopefully that sounds okay. I could hear the chat pinging on. Oh, thank you. People have been letting people in as we go. Great. So what I will do then, I'm going to hand over to you, Manish, for the next couple of slides. Is that all right? Does that come on to the physical activity slide for you now?
Yeah, thanks, Joel. So thanks everyone, and I can see Kath has joined as well. So I'm just to introduce
Great.
myself, I'm Professor Manish Parikh. I'm clinical professor of infectious diseases, and I work at the University of Leicester, and I'm co-leading this project with Kath Wolf from UCL. Just to give a bit of background in terms of the work, so I lead and Kath is co-I on a large study called UK Reach, which some of you will be aware of, which is a large longitudinal cohort study which was set up initially during COVID, actually, to look at ethnicity and COVID risk, funded by government. But when we first set it up, Kath and I were very keen that we would look more broadly at physical and mental health aspects. Now, there's been a lot been done on mental health, and there is stuff that we're doing on mental health, but there's a gap, particularly around physical health and healthcare workers. And we've done a number of pieces of work over the last couple of years, particularly looking at multiple long-term conditions. And now we're starting to see some data. In our data, we have some quite nice data starting to develop around physical activity. So, as I say, UK reaches around 25,000 healthcare workers. The data is being linked to people's the cohort data is being linked to their healthcare data. And one of the aspects we've been looking at is physical activity. So we collected this from the outset, and I'm just showing you some data here, which looks at the physical activity index, and we've basically classified people into whether they were inactive or active amongst healthcare workers. There's actually very little data out there. We presume that we know a lot about this, but actually we know relatively little. Although there are some really good studies out there, particularly in terms of interventions for some groups. I think where we've really missed an opportunity is looking at the diversity of the workforce. Secondly, where we've had to look at the intersection between diversity and occupational type. And then thirdly, I think the other area that we can think about, particularly in terms of interventions, is when they've been set up, have they been considering the diversity of the workforce, and have they been a long-term implemented intervention, or have they kind of been just a pilot thing which is stopped after a period of time? So I'm just showing you this table, and you don't need to remember this, but it's just to show this is looking at who's active and who's inactive amongst the cohort. So you can see that overall there's around 11,000 people that we've analysed this data. This is unpublished data at the moment. And you can see, just to bring out some key highlights, so the older we are, the older the healthcare worker, the more likely they're to be inactive, women more than men to be inactive. But then you can see some signal within the occupational groups. So, for example, compared to medics, nurses are less active. Some other groups particularly seem to be less active, particularly things like people working in dental roles or administration roles, particularly. Now, whether this is because they're inactive because of work or their 24-hour day outside of work, that's some work that we will need to do as part of this project. And then the other thing that we've started to look at is we've looked at ethnicity, but there is an interaction which is important, that we know that the NHS is becoming increasingly international. And we look at ethnicity and the interaction with migration, and you can see some interesting signals here, particularly in terms of the fact that uh, Asian staff are less active than those who are white. There are probably some differences between UK Asian and overseas born Asian staff. And similarly, we see some other signal within the other ethnic groups. So what I'm saying is, if we start to deal down into the activity levels of our workforce, the NHS workforce, there isn't a single homogenous group. There are differences amongst our colleagues and our staff. I work clinically, and we need to start to think about how those interventions that we develop can be kind of tailored for both their occupation. An admin member of staff will be very different to, say, a nurse. And secondly, in terms of considering the sort of diversity in the cultural experience as well. Should we go on to the next slide? So it was on the back of that and the work that we've been doing, looking at particularly around cardiometabolic disease in this cohort, that we were awarded funding, and it's a collaboration between the University of Leicester, UCL, also University of Newcastle, and we have partnerships from occupational health physicians at my trust in Leicester. And this is a short, what we call a development award, essentially. This is trying to develop the evidence base, which will then go on to form the basis of a larger grant, what we would call a longer 5-year program of work. So it's quite short, quite time limited, but we think it's an important area that needs to be understood and investigated. So there are three work packages. The first is setting up a network of NHS organisations, which we've called NHS Chorus, and hopefully we will chime in chorus at some point. But the important thing from our point of view here is that apart from this project, I think probably there is a wider question and piece around health and healthcare workers. There's quite a lot on mental health. It's a really important, but I think physical health has not been given the attention that it needs. And it could be that chorus becomes the formation or the basis of a larger network, or looking at physical health more broadly. Secondly, there's a piece about looking at what's going on already. We don't want to try and develop something if there are really good examples already out there in the UK. And then finally, Joel at the moment is doing a rapid review of the evidence for different interventions with healthcare workers. Who's being targeted? How good is it? Does it consider diversity and so on? So I'll stop there. I don't know, Kath, if you want to, I don't know if Kath is on because I think she's on, and but might want to just introduce herself briefly.
Hi everyone, thanks Manish. Yeah, that was a great overview. I'm Kath Wolf, I'm Professor of Medical Education Research at UCL, and it's great to see so many of you here today. We're really, really glad that you could make it. And yeah, really looking forward to hearing from you about how this network can help you and what you want from it as well. Thanks.
Thanks, Kath. Joel, should I pass back to you?
Yeah, great. Thank you. So just before you do, I'm just going to dip in. Like I said, I'm on one screen today, so I'm just sort of quickly checking in on whether there's anything to pick up. Okay, I just want to look down the chat. Great. I'm going to come back to this then. Like I say, if you have got a question, and do feel free to pop your hand up and share, come onto the mic if I'm missing any messages. But yeah, let's move on then. Thanks to Kath and Manish there for the overview and that bit of information there. And let's start thinking a bit more about NHS Chorus, this new network that everybody here has sort of signed up to be part of, and we're officially launching now through this meeting. So you'll have seen a little bit of information about that already. We shared some information when you were invited, and we've just spoken a little bit to it there. But I suppose effectively what we hope this can be is a network of trusts, people representing their trusts interested in physical activity and how that can be used to support the health and well-being of the workforce. Really, we see this as an opportunity to provide a platform for sort of sharing knowledge, sharing best practice, hearing about what's going on already, what's happening in trusts around the country, a sort of platform for kind of peer support, making connections with other people in other parts of the country or in other trusts who are working on things that are perhaps similar to or in your area of interest as well. And certainly we see this as something which, as Manish was just saying a moment ago, can facilitate future research in this area, an area which, as has been mentioned, we see as one with some real potential to develop new work in. So I mentioned briefly at the start that the initial sort of proposal was that we'd have 3 meetings over the next sort of 9 months or so, today being the first of those. So that would mean that we would be likely proposing a second meeting in the kind of in the new year, and another one perhaps sort of springtime or there and thereabouts of next year.
Oh, great stuff.
Oh, sorry, was that a question? Sorry. No. Perhaps maybe a mic on or something like that. I think I heard a voice then, but if I did miss a question, do let me know. So yeah, we're proposing these 3 meetings initially as part of the network, but also what we're going to set up is a Teams channel that everybody here will be given access to. So we're going to host a Teams channel via the University of Leicester, and over the kind of coming days and weeks, you will everybody who's registered basically to be part of this are going to be set up to have a guest access to that Teams channel. And what we hope is that that Teams channel itself can also kind of grow to facilitate a lot of these things that we're talking about. We can host resources, communicate with each other, see what each other are doing, share bits of information about what's going on already. We'll use this as a kind of a central resource for kind of facilitating this collaboration, this interaction, this work that we're hoping will grow from NHS Chorus. So when you've registered, you've given us your details like email address and so on, and we will use those over the, like I say, coming days and weeks to get that sort of set up so that everybody has access to this Teams channel. So I hope that sounds okay. Do let me know if you have questions as we go. But that's a bit of an introduction to NHS Chorus and how we see that sort of working, what we hope this can provide. But what I suggest we do now, then, actually, if there aren't any questions, is that we sort of move on to thinking about this area that was just mentioned briefly a couple of moments ago by me at the top and also by Manish, this bit of work that we're doing to map out current practice. We know that there is lots of things going on in the area already. Manish mentioned doing this rapid review at the moment of the literature on physical activity intervention for healthcare workers, but what we're really interested as well to understand is what's the landscape like at the moment across the NHS, what's happening in trusts already, so that we can use that as well to think about what might be a useful avenue to kind of progress this further forward in the future. And so what we're going to ask you to do, probably, I guess the first thing we're asking from you as a network member is to share information about interventions, initiatives, activities going on within your trust that are designed to support physical activity, increase physical activity, reduce sedentary behaviour. And in a few moments' time, what I'm going to do is I'm going to share a link to this to an MS form that we've created, where we've put a few questions to ask for people to fill in, to give us a bit of a sense of, are there things like this going on in your trust? And if so, what do they look like? Where can we find out a bit more about them? But before I share that link, what I think I just want to kind of really emphasize is that what we're interested here is really the kind of full breadth and range of things that might be going on within your trust. There's, I suppose, nothing too little or too large for us to be interested in. So I guess what I mean by that is, you might be aware of, well, within my trust, there's recently been a big research study where a kind of a structured exercise intervention was trialed, and that's been written up and published. Great, certainly we want to know about that, but we also want to know about anything and everything else as well. Maybe perhaps there's been some initiatives to try and encourage more people to walk or cycle to work, and you could apply for money off a bike to increase that, or maybe interventions that were designed to sort of reduce sedentary behaviour. People could apply to have a sort of a standing desk at work or something like that. Perhaps you know that there is a sort of regular lunchtime yoga or lunchtime kind of walk that isn't really formally evaluated, but it's been running for some time and you have a bit of kind of feedback on it from people who've taken part. Anything and everything, really, we're interested in understanding here. So the big formally evaluated interventions, but also, smaller things that haven't gone through sort of, been researched as such, but just practice that that's going on. We'd like to know about it. We want to use that to sort of build up this picture of the landscape and get a sense of what's going on. What are people already doing? What do we know about how this is being taken up? What kind of reach it has? What people say about it? That sort of thing.
Joel,
So,
there's
yeah.
a hand up and there's also a comment
Okay.
that a few people have liked. So yeah, I
Great.
can't actually see the name of the person who's got their hand up, but please
Okay.
switch off your mic and shout out. Yeah.
Super. Thanks for letting me know that, Kath. Yeah.
Hi,
Is it you, Philip?
it's Philip Smith here. So I guess we're at the kind of outset of this, and I'm just a simple bloke, but I get confused when it says NHS chorus because I think about singing and all the health benefits and well-being of things about singing. And then there's also the Thrive acronym. And I was just wondering whether at the outset, branding this as NHS chorus is going to be unhelpful in terms of how it lands with everybody else, and whether you want to switch to Thrive, because what I've noticed in the past is that short titles such as, that's what people latch onto, and it's going to cause a lot of confusion, I think, with colleagues. I don't know whether that's a general point or if everyone else has any thoughts.
Yeah, that's an interesting point. Thanks for sharing that, Philip. I don't know. I'm going to sort of look a little bit to
Yeah, that's a really good
Manish
point,
and
Philip.
Kath.
I think
Good thing with these headphones, though, is that I can.
Oh, sorry. I was just going to say, but thanks for that. That's a really helpful comment. I think there's two bits to this. One is Thrive is the overarching project, which will hopefully going to go on to become whatever Thrive 2, whatever we want to call it, the bigger project. When Kath and I discussed setting up NHS Chorus or this network, we saw that obviously there's Thrive, but we could probably see the value of it having longer benefits, longer term than just physical activity, given what our data is telling us. And we're very welcome to sing if we wish, but I'm not sure it's been brought into the agenda today. So, but I do think you're right. We could probably take that away and have a little chat to the team about. At the
Yeah,
moment, I think
'cause
Chorus was really set up to, I guess, to become a network which would then facilitate physical activity, physical health kind of interventions, and a network across NHS organisations that could feed into those projects. But that's a very good point. We can take that away and discuss that.
Yeah, because there are a number of programs that have established that singing is really good for health and
Oh yeah.
well-being. Just don't want to confuse what this is setting out to do.
Yeah, and
Yeah.
the chorus actually stands for something. It's
Yeah,
just,
no.
it doesn't say, it says the collaboration of healthcare research organizations. I think Andrea's asked, sorry, I think I'm just looking at, are you creating a network to create a data feed into the, yeah, so Andrea, I think as Joel was saying, we want to get an evidence base developed, or what's going on outside across the country, essentially, in terms of physical activity. And then really at this point, it would be about getting the information, but then obviously if we can get funded for the next round, which Kath and I hope will happen, then it would be quite a nice kind of collaboration to develop the intervention and roll it out across different organizations. So I think that would be a good scope. You've got your hand up, Andrew, so I don't know if you want to come in.
No, so thank you for that. So from that, you hope that that will sort of spin off maybe 5 or 6 other projects as part of the bigger grant, potentially, which means that the interest for us is that we could be a collaborator
Exactly.
within that rather than just a data feed. Is that correct?
That's right. So this is about developing, understanding what's going on across the organization. We then, in the next phase, Kata, we'll start writing this in January or February probably. If it's funded, then we would obviously develop this intervention or co-design it and roll it out across NHS organizations. It'll probably be a trial of some sort, but it would make absolutely the most sense. And that's what we would hope to, that we would come back to the organizations that are here to become, the collaborators in which to roll out that intervention, whatever it looks like eventually. I think someone's got their hand up, but I don't know if that.
I think
Is
that just
Andrea.
Sorry, I've got a lot of questions.
Oh no.
That's right.
I've totally forgotten what I was going to say as well, which is really embarrassing. Would that was it? Would it be adopted onto the NHS portfolio then, so sites could benefit from the accrual of all of the staff that they get through into the studies?
Yeah, so we've been in. So just to say that there's a line of studies that have happened. So UK Reach was the first. We then did a project called Reach Out, which was on COVID, and then we've just been currently something called iCare, which is looking at retention, and all of those have been on the portfolio and usually recruit in the several hundreds of patients. So so all the sites that are on those it's on the portfolio and they get their accruals as part of that. Absolutely. Joel, I don't know if you can see the chat anymore.
Yes.
Yeah.
Yeah. I've got it. I'm just keeping an eye. Catherine, thanks. You mentioned about the regular national and regional calls on NHS Futures platform. That's a useful point for us to think about. I don't know that we have sort of thought kind of concretely about that in terms of how we might connect with that, or what the kind of relationship could be with some of the calls that go on there and this platform. But that's a useful point to think. So yeah, I've made a note of that, and we can sort of take that to the team and think about how we use the information that comes through the Futures platform. Thank you for that. Then I think the some of the questions. I think the rest of the questions.
I was just going to say that, yeah, very happy for people to send their views around the name. I think Liz kind of probably summarizes better than I have, which is that we're coming together to answer a question in a sort of in a collaborative way, and it's about people from different backgrounds and different both work in different organizations to kind of hopefully come together to answer, in this case, something about physical activity. Next time it might be about something else completely. So thanks for that.
Great. And yes, Beth is sort of echoing a slightly similar point. Collating and raising awareness will already be impactful. Great, and thank you, Beth. Thanks for being part of that. Claire, I noticed, so will there be an emphasis on physical activity for colleagues who have disabilities and or mobility challenges? That's an interesting question. I think that isn't explicitly an angle that we have sort of talked in any great detail about, but I suppose that one of the things that's really useful about this network is that we can take, ideas that come through here and again pick that up and feed that into our thinking about this project and other work that could indeed grow out of that. I don't know whether you want to add anything to that, Kath or Manish, but my sense is that that's already an example of how this network can be helping us think about these sorts of things in useful ways.
Well, my view is that we should be inclusive. That the whole aim is to try and be inclusive of what's going on. So if there are exemplars across the country, we need to know about them so that we can then take that into the sort of summation of what we might use going forward. I think that what we really don't want to do, and is not good, is to try and create something new when there might be really excellent work going on outside. It's not a good use of taxpayers' money, and I think we probably should be trying to build on work that's already going on, hopefully, because that will be both quicker and easier to then achieve impact for our staff.
Indeed, yeah, absolutely. It gives us something to build on, and I suppose also if what we notify sort of gaps or absences of evidence through this process as well, that also is something useful for us to think about. If there are areas that haven't been addressed, then that can be something that kind of is identified as an area that's missing and that requires more thought, more original thought.
Yeah, one of the things that's interesting for me that I'm seeing in the chat is your comment, Catherine, about there already being a central place for resources on the NHS Futures platform, which, as I understand it, and please correct me if I'm wrong, is for NHS trusts to share with each other. And then your comments as well. Sorry, I'm just looking who it was, Beth, about collating and raising awareness of what exists. And I suppose maybe I would find it helpful to hear from you about whether it's useful to have us as academics and researchers, for example, or other people who are not actually, who wouldn't necessarily use NHS Futures, or I personally don't have access to it. And whether, how that would be useful to the network, that raising awareness outside of the NHS Futures platform and helping it inform other activity. I'm not sure if you have access to it, Manish, or if you have thoughts about that.
Yes, we do. I do have access. For example, in my reuse it. Well, I say I have access. I'm not sure I reuse it particularly, but it's around hepatitis, for example, or whatever. So there is a mechanism. I'm not sure how, as you say, there are people who won't have access. But I can see that Catherine's got her hand up, so I don't know if you wanted to come in, Catherine.
Oh, thank you. I was just highlighting it really, because if your starting point is the blank piece of paper, just to highlight that would be a really good place to start the national. So it's been happening since COVID times. The kind of the network calls were set up. So there's been a series of national calls. So any NHS trust, the staff health engaged generally, or occupational health leads will join, and it's very much about sharing kind of good practice. But there's also regional calls as well. So I think that there's a lot of sharing of what different trusts are doing. I think and that one of your questions, I think, was kind of what's going on in the areas, what are different trusts doing, and there is a lot of different activity, and I imagine some kind of survey or something to kind of gather that data. You get lots of different types of activity going on. I think where we could probably use help with is that kind of research-based guidance of what are the best things to be doing, and which trusts are doing this and that's got a better outcome, and kind of spreading, helping us to identify the best of the practice, because there's so many different approaches to it kind of nationwide. So there's definitely, I just thought I'd point out, if you're creating a new network, for this you're probably going to get a subset of everybody, whereas if you want to get more people that are already connected through the national or regional sites, and the NHS Features platform is, or in the NHS there are so many different places for information sharing. So my first thought was, oh, another place. Whereas we've got the NHS Features platform already. But I imagine that different people will access different ones, and any information sharing is really useful, isn't it? So.
Can I just come back to Catherine just to say that I think that's a really helpful comment, and I think we should definitely try and access it. I'm not sure I have access to that specific web page that you have. I guess just my reflection would be that the plan is obviously to collect information, but also to be a little bit like a research network so that we can then facilitate not just sharing of information, but actually then moving forward. Because description, in my view, is great up to a point, but actually let's try and change things and intervene if we can. So Kath and I are really keen that all the research that we do is not just focused on description, but actually trying to intervene and move things forward for staff. And we've become very exercised by this, particularly during COVID, but now really see the benefit of this because it's a understudied area really. But thank you, Catherine. We'll try and I'm not sure how we'll get access, but if you have any links to it, then it would be great to share with Joel or us, and we can try and see if we can get information from them.
Yeah, great. Well, brilliant. Well, thanks everybody. It's fantastic already seeing the usefulness of having people here in the know and thinking about this area, already sharing some useful thoughts and ideas, and we're obviously kind of keeping note of that, so that we can kind of give that some further thought. So I think I'm right in saying that we've now covered the points in the chat. Thank you very much for the questions and thoughts and feedback and comments and stuff. That's great. Kath, go on. You've got
sorry. There was one other point I think that I've spotted from Philip as well, which is about sustainability benefits of this. So I guess knock-on benefits that go beyond physical activity and the health benefits that come from physical activity to other benefits as well. So yeah, Philip, I don't know if you wanted to say something about that.
Yes, so I lead in my trust on one of our sustainability work packages, and what we're trying to do is reduce our overall carbon footprint, and a very big part of that is on travel. So if we can encourage staff to either not have to travel or travel using a more sustainable way, such as walking or cycling or other things, that can make a big difference. And I just think that might be an additional benefit of this work is around the promoting sustainability. Obviously, it's just a secondary benefit, but I think it's worth capturing if you can do a benefits analysis.
That's a really helpful point. Thank you. I don't think that we had thought about that or discussed it previously in our meetings. So that's really helpful for us to think about the additional benefits that may arise from this as well. So thank you. That's really helpful.
Great. Thanks, Philip. Thank you.
And somebody else has just put in there, maybe prompted by that, examples of, that's Christopher from Northumbria. Examples of best practice with infrastructure and estate will be an important factor as well. Yeah, please
jump in there. I was thinking about around there in some of the investment we've had as an organisation around changing facilities. We invested heavily in gym facilities as well. But there are aspects of the estate as well to encourage the sustainability package projects around travel as well. So we've got some examples we can certainly share around that as well.
Right.
Thank you.
Yeah, that's really useful, and a really useful kind of further extension of the point I was making, that actually the breadth of things we're interested in here is really wide, because we know that the range of things that are conceivable in this area and that we suspect are happening, it can be very varied. So some of the stuff you're talking about there that give a useful example there of the changes. It's not, you might think immediately of a physical exercise class or a yoga class or something, but actually the breadth of things that we could do in this area is much wider than that, as you're alluding to there, Christopher. So thanks for that. And Catherine, thanks. You've shared a link there, haven't you? So thank you. That's kind of following on from the discussion point, I think, from a very quick look at that. We'll have a sort of further look at that outside of the meeting. But thank you for dropping that into the chat. Okay, so we've got sort of a little over 20 minutes left. It's fantastic getting the feedback and the comments. So thank you from those of you who have. Claire, actually, you've also just popped a point. Financial constraints will also impact. Yeah, absolutely. And one of the things we're just thinking about is some of the kind of kind of theoretical sort of sides, the underpinnings of this in terms of like what might facilitate or what might get in the way or support some of these interventions. And you're right, actually, financial kind of context will definitely be an interesting factor to think about. And one of the sorts of things that from very, very early things that I'm noticing in the rapid review that we're looking at the moment is how few studies in this area have done any kind of cost effectiveness sort of work, and actually looking at, yes, there are resource implications for running these things, but there are potentially resource sort of savings and so on associated with some of that. So I think that's a really useful point that you're flagging there. Thank you, Claire. Don't know if you wanted to come on and say anything further about that, please by all means do. Just whilst I give you a moment, Fiona as well. The nice guidance on obesity also sets our standards for how NHS Trust can support our staff. Have done an audit on this recently. Okay, that's interesting, Fiona. Yeah, if there was anything you wanted to share on that, Manisha's actually already said, if there was something you want to share on that, that would be great. We'd be interested to sort of see what came from that.
Yeah, would be happy to share at some point. At the moment, we're just kind of weaving it into our strategy as we're developing the 10-year plan. But certainly feedback from staff was that they would like to have some more support within this area. A lot of the NICE guidance looked at the kind of healthy workplaces, access to healthy food, access to showering facilities, should you be cycling to work, and the ability to be able to incorporate physical activity into your working day role. So the guidance, is there, and it's interesting. We're a large community organisation, so a lot of it is hard to kind of weave into our daily practice because staff are working here, there, and everywhere. But yeah, it's definitely a good one to use as a starting block.
Yeah, that's really helpful, and that'd be great to hear more about. I think Manish and Kath have alluded to, what we want is to build a picture of what is actually happening out there in the real world. What are the challenges that are being faced? What are the reach that some of these things have? How is this actually implementable in kind of the real world healthcare workforce settings that people here are working in? And so that information you're talking about there sounds like that'd be helpful in building some of that picture. Okay, a couple more comments as well. Great, Bernadette, keen on a health inequality angle, looking at what is also available within the community, an integrated neighbourhood approach, utilising assets available where people live and work. We currently look at targeted support for ageing workforce. Yeah, that's interesting, Bernadette. I think the health inequality angle is really important, and understanding, how we can develop interventions and things that have a good reach, that reach hard to reach parts of the workforce, and that really consider kind of health inequalities kind of right throughout that. So completely sort of agreeing with that. Lisa,
can I just come in on that?
Yeah.
I think that's a really, we're very much about health inequalities, this project. And I think that's a great point about what is available within the community, because other work that Manish and I are doing on retention of NHS staff from ethnic minority and migrant groups has found that, maybe unsurprisingly, staff who come to work in the NHS from overseas report that they're kind of less embedded in their local communities as well. So I think understanding what's going on for staff in and outside work in terms of various different aspects of their life, including obviously physical activity and health, is really important. So thank you so much for bringing that up. And if there's any work that people are doing around this as well that that you're doing or others are doing, would be really interested to hear about it.
Yeah, absolutely. Thanks, Kath. I can see a couple more comments in the chat, but I noticed, Philip, you've also got a hand up. So why don't we come to you, and then we'll pick up the questions in the chat afterwards.
So if I'm over contributing, please do let me know.
That's very welcome.
But in terms of kind of an assessment, so I imagine that you could look at this, that there's the formal stuff where the employing organisation promotes physical activity in terms of making bike to work scheme available and encouraging people to have a lunch break, and providing showers in the place. Then there's a whole range of unintended barriers to physical activity as a result of working in the workplace. So there's that whole kind of formal bit, and then there's the informal network. So for example, I formed a running club, so a group of us go running once a month, and colleagues do the same. So I think there's a kind of a top-down enabler stroke barrier thing, and then there's a bottom-up initiative thing, because a whole range of people do things like play badminton as a team social event once a month, and a whole range of things like that. So there's definitely a formal versus an informal thing, and then there's a enabler and a barrier as well. Just help unpack it a bit.
Yeah, that's interesting. Thanks, Philip. Yeah, I think that's right. There are probably a whole range of different ways these sorts of things are offered or woven into the offer for the workforce. And I think, yeah, it'll be interesting to try and unpick a bit of that as we start to build up this picture of what is going on. What does the landscape for this look like? I think, yeah, there'd be perhaps an interesting way of conceptualizing it that you're thinking of there in terms of differentiating between kind of formal and informal offers. And certainly that some of that underpinning, what gets in the way or facilitates these things is will definitely be really key and really central to what we're interested in. Because I think already what we're seeing is there's loads of different stuff being trialed, and lots of different things happening in lots of different settings. And really, to understand how to design effective interventions, we need to know as well as whether or not some of those things work. Actually, what gets in the way, or what facilitates the success, or gets in the way of the success of those sorts of things. So trying to unpick some of that, I think, will be really important. Thanks for that, Philip. James. Hi, James.
Yeah, thanks, Joel. It's only a very quick one, and it may not sit appropriately now in the context of this conversation, but happy to loop it in if it is. I just wondered whether or not you've engaged at all yet with other outside organisations like CIMSPA, for example. So for those colleagues that might not be aware of CIMSPA, it's the Chartered Institute for Sport and for the Management of Sport and Physical Activity. The reason I mentioned that is my background before joining the NHS was in performance sport, and I still do some work with CIMSPA at the moment around the health agenda, and part of which is sitting on the professional development board. And the second part of it is I chair the Health Network and the Health Committee for their professional standards development. And I'm sure they'd be very keen to sort of work in terms of with yourselves in terms of what this might mean for wider pilot programs of work or initiatives. And equally, they'll have got lots of information, research and data that I'm sure will help underpin where there's been successes. I know at the moment there's a couple of big programs of work happening with the DWP in terms of professional development of standards and the role of sport and physical activity in terms of improvements around health for disenfranchised networks and other sort of aspects of sort of societal impact from sport and physical activity. So particularly around things like target attainment, the ability to lead a fully fulfilled life, the impact on happiness, life satisfaction, the kind of ONS question sets. They've done a lot of research and data with sort of unemployed networks in particular around that. So there's probably a few avenues, I'd say, that not directly linked to the work you're doing fundamentally through this cohort piece of work, but might help from a data perspective and link in with some of the wider kind of sport and physical activity sort of strategy pieces, if you like. So happy to pick any of that up if it is at all helpful as part of these conversations.
Joel, could I just come in? I think that's really helpful,
do,
James. Actually, that's really, really helpful. And I don't know if Charlotte's on the call, but I didn't name all the co-Is, but there's Charlotte Edwardson and Tom Yates who are the lifestyle group and work particularly on physical activity and exercise at the University of Leicester, and may have links. But if not, I think we probably, Joel, just need to follow up with James separately if in terms of time. But that sounds great. Thanks, James.
Yeah, for sure. Thanks, James. And yeah, Christopher, you've got a hand up as well. Thanks.
Yeah, just to jump on James's comment about SimSpa as well, because we're a partner organisation with SimSpa, so our physical activity staff in the organisation are all professionally registered through there. We've got access to all the CPD opportunities that staff can get through there. So just to jump on that to say that we've got an example of how that kind of works with our staff as a partner organisation there as well.
Right. Well, yeah, thank you for sharing that, both of you. And yeah, I will follow up. We'll sort of have a chat in the team as to see, like Manish was saying, that to what extent, if at all, other team members are linked in or aware of those groups. But yeah, I'll perhaps follow up with you both if that sounds okay, just to get a bit more information about that outside this meeting. Great. All right. Thank you. Well, yeah, so this is fantastic, getting lots of really useful stuff being shared in the chat. I'm looking at, slightly conscious of the time and seeing where we are in terms of the time we've got left for the meeting. So it might be that there's a few of those things that I sort of go through in the comments where people have shared some further bits, and we can follow up on some of those things separately. I can see Charlie, you've got a hand up, and we'll just then save a bit of time as well, just to talk a bit about some of the sort of next steps. But Charlie, why don't I come to you?
Thanks so much, Joel. That's really helpful. No, it was just a quick question. Someone earlier on the call just mentioned the NHS Futures page. I've managed to get access to that. I just wonder if whoever it was wouldn't mind sharing with me the particular chat group or forum or dashboard or whatever it is, or workspace, sorry, that's the technical term, the workspace that they found some stuff in, because I'd be interested to look at that. So thank you if anyone could just ping me that over. Thanks so much.
Great, Charlie, thanks very much. So yeah, I think, was it Catherine? I think it was you who had initially flagged that. If there is a link to that platform, that would be great. Again, perhaps I can follow up with you separately to see if we can identify that. Now, so does anybody else have anything else they want to say? I mean, Kath, Manish, or just anybody more generally? I can see there are a number of things that have been shared which look great. It might, as I say, be that we need to sort of have a look at some of that in a bit more detail outside the context of this this meeting, because of the limits of time. But what I'm sort of seeing. Oh, sorry, Kath.
No, sorry, I didn't want to interrupt you, Joel. Sorry. I was just going to say that I can see already in the chat, people are starting to interact with each other and wanting to share with each other, which is great. So I'm sure you were going to do this already, Joel, but I was just thinking about the teams and how people can continue to do that. Sorry for interrupting.
No worries at all. Great. No, exactly. Thinking along the same lines, just exactly saying, sort of seeing already great evidence, aren't we, of what we're hoping this network can facilitate, and the way that we can sort of share and learn from each other is evident already. So yeah, the Teams channel that I mentioned earlier, we've got that set up. It's hosted by the University of Leicester, and I will be registering people who have registered to this network to that. So over the kind of coming days and weeks, you will get an email when that is set up, basically, which will mean you have this sort of guest access to this Teams channel, and yeah, we'll be able to use that. I mean, I'm sure people here are all familiar with Teams channels, but nonetheless there'll be some sort of instructions sent out anyway. But we'll be able to use that to post and share and interact with each other, to host resources, to share links, to facilitate all this kind of collaboration and carry on some of the great interaction and sort of ideas sharing that we're starting here in this meeting. So it's fantastic, and it's also just great to see people demonstrating an excitement and enthusiasm for this. Is clearly one of the advantages of getting people together who are interested in and working in this area. There's a kind of a motivating enthusiasm for things that are coming through from people's comments. So it's fantastic. Brilliant. Well, so we've got a little under 10 minutes left. Oh, thanks, Catherine. I've just noticed your point about the collaboration platform. Charlie, if you haven't seen that, that's in the chat there. Catherine's linked the Futures collaboration platform there. So yeah, let's think then a little bit about the sort of bits that will follow on from this then. So I'm going to drop a link in here to the chat. This is a Microsoft Forms link that we have set up just to start gathering a bit of information about some of the things that you're sort of already talking about here. So I'm going to share my screen, but actually I've just popped the link in, so you might want to just open this on your own screen anyway. But you'll see it's a very simple MS Forms that we've set up as a way of trying to make it easy just to sort of pull together some information about what's going on around the country. So we're just asking you to take a few minutes, if you can, over the rest of today or whenever you get a chance, realistically, and in the coming days and weeks, to put in your name and the trust you're affiliated with, and then just a little bit of information about any intervention, activity, initiative, anything you know of that's taking or taken place in your trust, designed to support physical activity in the workforce. I've put a couple of prompts here of sorts of things it would be helpful if for us to know a bit about what actually was this initiative, what does it consist of, if you know a bit about how it was designed or who it was for, what its aims were, the approximate number of people as it reached, and so on. Great, but don't feel completely tied to that. If you know the answers to some of those and not all, that's fine. If you've got just a sentence or two for each bit, then that is all fine. Not expecting people to spend ages on this, but drop in a bit of a picture for us about some of the stuff that's going on in your trust. And then if you have links to things, if there's places we can go on publicly facing websites to find out more about that, if you can drop links there, that would be great. Maybe there's something on your trust website, or maybe there's been something published. If there's nothing on kind of like publicly facing websites, but you do know you have got some resources or like an internal service evaluation or some materials from something you tried, we couldn't find them anywhere online, but you're happy to share them with us, that would be great. Once we've got people sort of up on this Teams channel, we'll make it so that you can just drop things in. We'll put folders there for people to kind of start collating some of this. But in the meantime, if you just want to email stuff to me directly, that would be great. I've put my email address there. It's jgo3 at Leicester. If you want to just drop me an email with things as well, and we can start through that to build this picture of kind of what's going on around the country. So I've shared that link there in the hope that people might, you can fill that in multiple times if you want. If you had a couple of minutes towards the end of this meeting and you wanted to just drop one or two things in so that we, by the end of today, we're starting to piece some of this together, that'd be fantastic. But I've put that link there, so that's available for people to have a look at and put things in over the next coming days and weeks. As we roll around towards 2 o'clock, I wonder if it's useful for us just to think again about briefly about what we might want from the next two meetings. So I'm just going to come back onto my slides. So I've said that the initial plan is that we would have another 2 meetings over the next sort of 8-9 months. And we were just interested to get a bit of a sense of what people might want from those meetings. We've got a couple of ideas of things we think it'd be useful to spend some of that time for, that it might be interesting to update briefly on some of the emerging findings from this kind of mapping exercise that we're sort of starting here now, and also from this rapid review that we kind of talked about. So it might be useful just to sort of update a bit on what we're finding through that. But I'm interested to get a sense from people as well, whether there are other things that you would want, other ways you would, other things you might want from a meeting, ideas you have about how we might make the best use of any time that we have together in subsequent meetings in the new year. Just interested to get any thoughts. If you want to drop a message in the chat or pop your hand up and just let us know, then feedback in a kind of collaborative way of thinking about these meetings would be much appreciated.
Joel, just to say, I think Andrea has asked about consent as a site to share information. I don't think this needs consent. I don't think, Kath, is. I mean, these are documents or information that are available within the NHS organisation. I don't think we're asking for personal information about people, etc. We've done a similar exercise for iCare, the retention project, which is shared, which didn't have consent, and it's run, it's been published, etc. So I don't think there's a consent issue, unless Kath, you think that's wrong.
No, I wasn't sure, Andrea, if I mean, I've seen your comment, but I don't know if you wanted to elaborate on it, or who would consent.
Just the site as saying, yes, we are part of this collaboration. I just
I
wondered,
see.
because if they've got specific initiatives which are theirs, how then by sharing it, does it affect their IP?
Okay. So, I mean, I would say really, as far as we're concerned, we wouldn't ask you to share anything that is commercially sensitive or that the trust wouldn't want you to share. So we're only really asking for things that you might share anyway. It's just, you know, that we might not have seen that or anything like that. Does that make sense to you? Yeah. Anyone else got any similar kind of queries around that? Anything, or you can always drop us an email if you've got any specific queries about that. Thanks for raising it.
Yeah, I've popped the sort of central mailbox there into the chat as well, so as a way of getting in contact. Although actually, hang on, I've noticed I've spelled Leicester wrong, so that's not a good start. So ignore that one, and I'll have another go at writing Leicester. Great. I can see a couple of comments about meeting 2-3. Yeah, Beth, that's an interesting idea. Maybe it'd be useful to try and hold a bit longer time for the subsequent meetings, so that we could allow for some of that stuff, because I think that would be really helpful, wouldn't it? Get into some smaller groups and breakout rooms. That might be a good way of facilitating a bit more discussion. Great.
Just on that point, I'm interested about the timing. So we chose today because we thought it was kind of lunchtime, and that might make it easier for people to attend and keeping it to an hour. But if people can do longer, or they want longer, or any other ideas about when it should be or how long it should be, then do let us know as well.
Absolutely. And so, as well as that central mailbox, I've also just popped my email address there, which I also did, mentioned in the chat. If you want to sort of ping things over, if you've got stuff to hand and you think, oh well, I'll just do that quickly now, and before it sort of comes off my desk, please do, pop stuff into an email to me. I'll get it sorted onto that team channel. Within a week or so, you'll be able to get onto that channel yourself anyway. But yeah, if you want to just clear something off your desk and get something in now, fantastic. Ping it over to me on that email address. Super. All right. Well, that's sort of bringing us up to the hour, and we appreciate very much everybody making the time for joining us today and being part of this meeting. We'll be around in the next few minutes to hang on here in case anybody has any further questions or comments. Please, by all means, do. But otherwise, thanks very much for joining us today. And keep an eye out for some further communication for us, and we look forward to working together and doing more of what we've started here in this meeting. Stop the recording now. Helen and Bernadette, I can see that you hung on for a question. Please, by all means, let us know if there is anything you wanted to ask.